Hello and welcome to the Divorced Dadvocate, where we help dads create a healthier and less traumatic divorce. My name is Jude Sandoval and I am your host. Today, we are going to be talking about something that I don't feel like, and I know that I didn't think about or think too much about aging, not only our own aging, but those around us that are aging, or parents that are aging, and resources that we can utilize to assist us in that whole process. Before we get to that, though, I do want to just remind everybody that the divorce quiz is still up on the website at thedivorcedadvocate.com. It is an awesome tool to kind of assess where you're at in the divorce process compared to others who have gone through it. If you take the 10 or 15 minutes to complete it, it's going to spit out some results that'll help you gauge where you're at. And if you'd like, you can also schedule some time with me for free to assess those results. So go to the divorcedadvocate.com and click on the divorce quiz tab and go through that. So my guest today is the co-founder of AgeWise Colorado. It's board president and all-in volunteer. Basically, this guy does it all. I can appreciate that also as well, doing everything here at the Divorced Advocate as well. AgeWise is a small but mighty nonprofit with big plans. He also co-founded the Colorado Center for Aging, which is the successor organization to the Colorado Senior Lobby, where he served as its board president for 3 years. CCA provides education, information, and advocacy for older Coloradans. He's a member of the Dr. Cog Advisory Committee on Aging and a long-serving board member of A Little Help, which is where we connected volunteering. Please help me in welcoming Bob Brocker. Welcome, Bob.
Oh, well, thank you very much. And thanks for inviting me. I really appreciate what you're doing with the Dadvocates. I too have been through a divorce many years ago. And I'm sure I would have appreciated having someone like you to talk with.
Well, it's my pleasure. It's amazing how many of us are out there that that have gone through it. And you know, we reconnected this week, and like I said, we connected. I don't know how many years and years ago through A Little Help, which is a phenomenal organization that we both volunteer for. In talking about your new endeavor here at AgeWise, it got me thinking about the divorce process and how many of us have our parents that are involved, hopefully involved, right, in our families and with our children, and that we don't really think about the impact that our divorce has, but we also don't think of, or has on our parents that might be older and aging, but also we don't kind of consider the impact that that challenges that they might be having or soon to have are going to have on us as now divorced fathers with our families. And the other part of that being those of us like myself who are starting to go past that half-century mark in our lives need to start thinking about aging and the resources out there. And so that's why I wanted us to have this discussion today. But before we kind of get into some of those details around that, tell me a little bit more about your background and also what brought you to working with the aging community.
Yeah, I'd be happy to. So I actually worked in the railroad industry for most of my career, primarily in operations, management, executive positions there, and some of the other departments at the railroad. They have every department you can imagine. So yeah, it's a big operation. Did some consulting work for a while. Worked for some software companies that are focused in the railroad business. piloted a railroad bankruptcy down in the middle of Texas a few years ago.
Wow.
What most people don't know is when a railroad goes into bankruptcy, the federal government steps in and appoints a trustee and et cetera. So it's kind of a big deal. Even though the railroad could be very small, it's still a railroad. And so during all that time, though, I had some time to start doing a little volunteer work, which I had never really done before. And so that's where I got involved in an organization that was called at the time Washington Park Cares, which later became a Little Help. And so I served as a president of that board for about 5 years during a time when we were really just trying to take off. You know, we hired our first executive director and subsequently hired another person to work with the executive director a few years later. And then the organization, you know, we changed the name because we wanted to make sure we were able to provide services outside of the Washington Park area, which is kind of how it was defined. And that all worked out. You know, over the next 10 plus years, the organization has grown to include most of the Denver metro area, Jefferson County, an office in Larimer County, another one in Berthoud, one in Glenwood Springs right now, and probably Grand Junction pretty soon. So
Wow.
we're going to have, you know, probably a little over 1,000 members and several thousand volunteers. And the volunteer process for Little Help is very simple. And that's how we, you know, Jude and I met, you know, with Jude's girls, coming out to do some volunteer work on a Saturday,
right,
at people's homes. And so that kind of activity continues to this day. A Little Help invites families, young families, to get involved and to teach kids about volunteering at an early age, and to, in some cases, kind of adopt new grandparents, sort of, because the real grandparents, you know, are living far away. And so in many cases, that's worked out as well. So it's a great organization to connect people. And so from there, I got involved with Colorado Senior Lobby, which is all about educating and providing information and doing advocacy work for aging adult issues in the state of Colorado. And so we did a lot of work there, got some pretty important bills, excuse me, some pretty important bills in the hopper, including one last session, which was focused on increasing the number of geriatric healthcare providers in the state by providing some tuition loan reimbursement for nurse practitioners and physician assistants.
Wow.
And the number of, you know, geriatric healthcare providers in the state of Colorado is actually less than 100. And there are approximately now a little over 1 million people who are over the age of 65.
Wow.
So, you know, the ratio is not very good. And so we need to keep encouraging more and more people to have a geriatric training track when they're going through their medical school program, which whatever that might be. So we continue to do that. And so the reason that the geriatric thing is so important is because as people get older and older and older, especially the oldest old, they need different kinds of health care. You know, it's easy to get too many medications, and they counteract one another and cause problems. It's also a situation where the geriatric trained healthcare provider tends to spend more time with the patient and ask them more questions and have a better understanding of how they really feel, and that can reduce the amount of actual care that they really need. And it also helps people stay out of nursing homes a lot longer and maybe forever. So this is important stuff that I don't think a lot of people give much consideration to. You know, we kind of go along with our daily lives, you know, especially when you're going through a divorce situation.
Right.
You need to focus more on yourself and your kids. And,
Right.
so what's going on there, and, how do you deal with that? And then, you wake up one day and suddenly you're older, and
Yeah.
parents are older. And so you need to know some stuff that you don't know. And so the job of AgeWise Colorado, which is an organization we started last year and really only got launched this year because we spent all that time in between building a website, designing a website, getting funding from, as a nonprofit, you can only get funding from foundations. So there's a foundation here in Colorado called the Next 50 Initiative,
Mm-hmm.
which was formed to do exactly that, to provide funding to organizations that are in the aging space in some fashion. So they provide funding to many organizations, like ours and different than ours too. So that's how we got rolling. And the whole purpose of this is really to provide information, education, and vetted resources to the people of Colorado. And our primary focus is on people in this, what we call the sandwich generation. And you all know who you are.
Yes.
You have at home, you have aging parents. At some point, you have demands from both of them.
Right.
And when that happens, where do you turn? I mean, for help.
Right.
Where do you turn for information? And, the typical answer is, well, I just Google it.
Yeah.
When you Google anything, you know how Google works. I mean, it's whoever pays the most money to be listed first, and that's how it works.
Right.
So I could be somebody who's really good or someone who's not that great. And so what we're doing is we're providing the background information about what the issue actually is, or the issues actually are, I should say. And they could be things like in-home care and need home modifications so that the parents can stay in their homes longer. Maybe they need some financial planning help. Maybe they need help with end of life planning, and perhaps it's time for them to move into a assisted living situation. And where do you go, and how do you find the people that will help you?
Right. So let's talk about that briefly, because that's the whole crux of what I wanted, your expertise on. And what I envision is in hopefully for AgeWise, like you have your vision, I have my vision. I have my vision for your organization, right, Bob? No, but like a little help has grown, and we've seen it now. So you've been there since the beginning. I've seen it for the last 7-8 years or that I've been involved, but it has grown from this small neighborhood organization because of such a drastic need that now it's statewide. And it's a brilliant concept that I foresee could go nationally if they decide to do that. But it's the same with AgeWise and needing the information that is out there and the help and the resources that you can provide in for us and us being the people of this show that are the sandwich, right? So we are the sandwich generation that you're talking about. We have kids that, whether they're young, whatever they're at, they might be still young, but even they might be teens. But then we also have parents that are grandparents, and they're involved in their lives. And we're going through this process, like you said, of like trying to figure things out. They're involved in our lives. They're involved in our children's lives, but we need to be planning for what's going to happen when something happens, or they get sick, or they're not able to be in our lives. And then we're actually having to help them in addition to what we're already doing through our lives. So let's talk about first the planning process around that. What resources are out there for saying, okay, we're recognizing that you're aging and that's you're getting to the point where we need to start thinking about this. What are some resources out there, or a start for people to start that planning process?
Well, there are actually quite a few, and a lot of it depends on income levels.
Okay.
So people in higher income levels are with what I would say is an adequate savings to carry them through the rest of their lives are actually that's actually a pretty small number, percentage wise. It's probably around 20 to 25%
Right.
of the aging adult population. And then you have another group who's kind of in the middle, who, barring a crisis of some kind, they're probably going to be okay. But if they have a crisis, then they're in big trouble.
You're just kind of on the border, right?
Yes. And then you have another group who are the lower income, the really lower income people who are living at or below the federal poverty level. And maybe they're dependent solely on Social Security. They don't have any other savings, any other income. For those people in particular, there is something called the Older Americans Act. It was created in 1965 and then updated in 1973 to create something called the Area Agencies on Aging, which every state has area agencies on aging that cover every county in the state. And they're typically, the funding that comes down from the federal government is then taken through what in Colorado is called the State Unit on Aging. And then that money is then passed out to the various, what I would refer to here as AAAs, and not the guys who start your car, the AAAs, the Area Agencies on Aging. And in Colorado, there are 16 of those. The largest one is in the Denver metro area. It's called the Dr. COG, which stands for the Denver Regional Council of Governments, AAA, and it covers like 6 counties. And so their job really is to administer the funds that come from Washington and from the state governments. Various states have appropriated money in different ways to go into this program as well. And the bottom line, though, is because the population is aging so quickly. Colorado is aging very fast, but every state is really.
Right.
And there's just not enough money. And so it's a constant struggle to find the funding that's needed to provide the services. And some of those services are things like.
So can I stop you real quick? Because I just want to understand this. So these AAAs, Area Agencies on Aging, are across the nation in every state, right? That's all. They have them because it's based upon the Older Americans Act. So the federal government has structured this as like a resource that anybody can access. So wherever you're at in those 3 categories, this could be a starting point for anybody to come and just try to get some direction on maybe planning or whatever, wherever you might be, as an initial point of contact.
Yes.
I understood that correctly. Okay, cool. So
that's pretty much true. And if you're over the age of 60, that's really all it takes.
Right. As far as to tap into actual resources or services to get, which we're going to get into next, which you were seamlessly leading into without me even asking. So then what are some of those resources?
They include things like legal services, nutrition. So this is where the Meals on Wheels program actually originated, was with the Americans Act. In-home services like homemaker type things, doing chores around the house, respite care for caregivers. There's something called disease prevention and health promotion, some of those kinds of activities. One of the largest ones, as you would expect, is the need for transportation.
Yeah.
because so many people can no longer drive, and there are so many people that live alone and that have no immediate family nearby. I mean,
Right.
it's really incredible. I mean, they're kind of hidden, and you've seen this, Jude, with
Yes.
with a little help. And you walk by a house maybe every day and you never see anyone. Well, there's someone in there,
Right.
and they're living by themselves and they hardly ever see anybody. So just having people visit them is huge. And then there's the ombudsman program. Now, the ombudsman program is a statewide program, and every state has one of those too. And it's called the long-term care ombudsman. So what the job of the long-term care ombudsman office actually is to advocate for the residents of long-term care facilities.
Mm.
Now, they don't have any authority to fine or punish, the owner of the facility. What they're there to do is take calls from the residents, investigate complaints that they might have, deal with the management at the facility to try to resolve the issues. I mean, so it's really all about, talking through the process and trying to resolve whatever those issues are in that manner. So that's what the ombudsman program is. And there are many volunteer ombudsmen scattered across this state and every other state. They go through a training program to learn how to be an ombudsman, and then they go out and do their work. So it's a very important program. There's some tax counseling available in some cases. There could be some other issues like, maybe some minor home repairs that can be funded through, particularly through the Medicaid program.
Mm-hmm.
So Medicaid itself actually pays for quite a few things if you qualify.
Right.
So then there are people who are in the business of helping you qualify. And it's actually it can be a very complicated process.
Well, it's government, right? So it's not going to be easy.
Yeah, that's absolutely true. Yeah.
So what advice would you have for those in this, what you describe as the sandwich generation, for starting this process and having the conversation with your parents about this, and then what would be a first step to creating a plan, if you will?
Well, I think the primary thing is to educate yourself as much as you possibly can. We have on the AgeWise website, we have quite a few educational blogs. We add more all the time. And then you can also go to something, we have what we call participating providers. Some of those are, we also call community resources. AAA is a community resource.
Okay.
The State on Aging is a community resource. So they're on there, and we're adding more all the time. And you can look at some of their websites and see, what kind, how you would interact with them depending on where you live in the state. So if you live in the Denver metro area, you're going to be dealing with the Dr. Cog AAA.
Okay.
And they have resources on their website, that educational resources and others. You can also call them. And I think that's true of all the AAAs. You can pick up the phone, call and say, I need help with X. And somebody can tell you where to find that help. So that's the AAAs are an excellent resource. Sometimes some of the public library systems in the state have good aging related programs. So you can learn about a lot of the issues of aging through them. If you're interested in demographics, this state and every state has a has a state demographer's office. And if you go to their website, you can learn a lot about the population, all the numbers, what's being predicted in the future, where the areas of need are. It's actually pretty interesting stuff. I mean, besides just the numbers, but all the narrative that goes with the numbers, and right. And you can call their office and ask questions too. I mean,
so that's an interesting point that you just made that I want to touch on is getting yourself educated about the process, right? Because like I said, I'm getting older. I've dealt with some of it with my mom. So I had some exposure to that, but if you've not had any exposure to it, you really don't know. And if you're like my mom was, she didn't want to deal with it. She wanted to be in denial. She didn't want to, and there's a lot of people that don't want to do that. So I think that's a great point, Bob, is get yourself educated around the different resources that are, well, maybe first and give me your feedback on this. Maybe first get yourself educated on what you can do to start planning within your own power, without, even if you have somebody that's like cantankerous and not wanting to talk about it or deal with it, but get yourself educated on what you can do, and then get yourself educated on maybe the process and what might come down the pipeline, because then at least it doesn't become a surprise and then you're reacting instead of planning.
Right.
Would you agree with that?
Oh, yes, definitely. And there are more and more and more companies now, startups in particular, who are coming up with different technologies to help with the people who want to age in place, stay in their home, and connecting them to their families who don't live next door. And so there are apps that have been created, and there's hardware that's been created. Oh. Some of it's better than others, of course, so you always have to deal with that. But the bottom line, though, is the business world has discovered that this is a market, and so they're on it. Believe me, they're all over it. And so that's why you see new assisted living places going up. Here in Denver, there's one being built, as we speak, not too far from where I live, and you get advertising from these people all the time. So they're out there, and so that's one thing. But then this technology area is fascinating to me. But then we have people who are in the business of actually helping to educate the older adults about how to use the technology.
Mm-hmm. Right.
So that's another business and or a nonprofit. There are a couple of nonprofits that do that. One is called Senior Planet, which is affiliated now with the AARP. And then there's another one here in Denver area called Generation Exchange, which is a little organization that was started by a friend of mine, young guy, who enlists college students to have, they kind of have these technology learning, I say party, it's not really a party, but it's a gathering where they sit down one-on-one with people and teach them how to use an app or apps, or how to use a particular piece of technology. Because no matter how much technology you put out there, or if you don't know how to use it, it just sits on the shelf. So that's all important too.
That's a fantastic point. Also, because I hear, but I also is one of my fears is that you're gonna get old and end up like you hear that end up in a home like just isolated by yourself. And these technologies really are fantastic opportunities to mitigate that fear with anybody, myself or somebody that's older, that wow, we can stay connected. You're not isolated. You're not going to end up, just dying in a home, right? It's for a lack of better way to phrase it. And so maybe starting with something like that, and then not to mention that it's kind of cool learning some of these new technologies and fun things. And like, so now I'm like sounding old, right? Because some of this stuff is getting beyond me. And I'm at that generation that's started with the computers and started growing up on the computers. So now, it's like, oh my God, this stuff is really passing by me too.
I mean, yes, and it does. I mean, and even the really young people who are very comfortable with all this stuff, the same thing's going to happen to them.
Yes, exactly. Use listening that our youngsters just know it's going to happen to you too.
Yeah, it will happen. It'll take more. It'll take longer for them, but the pace of change is just so fast.
Yeah.
We see it every day, and we see it so much that we stop noticing it. You have to just kind of step back and look and think about, well, was that here last year or even last month? And now it's this big deal, popular, everybody's using it, and then things fade away.
Right.
So,
Yeah. And so one of the last things I want to talk about is then also the local organizations like AgeWise, A Little Help, et cetera, that kind of fill in all these gaps that you were talking about. You got the AAAs, and you got some of this federal stuff, and but there are a ton of phenomenal organizations like yours and A Little Help that are helping older Americans. But here's the flip side. You mentioned earlier about bridging that generational gap with like my daughter's volunteering, and some of the most amazing experiences that my daughters have had with an older generation has been through doing our work with A Little Help and meeting some of these folks and talking with them. And then, they don't just get the old person feedback from dad anymore, right? It's other people that might be a generation older than dad, talking to them about this stuff. And at the same time, you're doing just amazing things that are helping amazing people. Just talk a little bit about that. I cannot emphasize enough how appreciative I am of your organization, A Little Help, and what it's done for our family in helping to do all those things that I just described.
well, one of the things, and I had a conversation with someone else about this just yesterday, but one of the things that I've noticed is that younger people are much more willing to dive in and volunteer and do things that help improve the community, the climate, all of the big stuff, than people of my generation were at that age anyway. Now, yeah, older, retired, we have a lot of time, and some of us choose to use it in this way. But when we were younger, I mean, that wasn't something that was top of mind, to
right
volunteer in the organizations like A Little Help. I mean, for the most part, didn't even exist anyway. But just thinking about doing that for other people was not something that we really thought much about. And what I'm seeing now with people of the millennial generation and the generation below that, we're seeing just a lot more people willing to jump in and get involved and help other folks along the way. And I think it's really great seeing these families like yours engage their kids, because they're learning about volunteering and the value of it at a very young age, and that will stay with them the rest of their lives.
Absolutely. And no matter how much they complain about having to get up on a Saturday, and it's always great. A Little Help has donuts, which is always a positive motivator for children. But no matter how much they complain about getting up or going or sweating through a hot afternoon or fall, or, we do the stuff in spring and fall. Our experience, Bob, we've had amazing experiences. One lady was a makeup artist in Hollywood, and she shared all these stories. Another guy was this artist who created all these amazing lawnscapes out of metals. Another guy would do wildlife shows. And so it's all these older people that have these experiences, and you just never know who you're going to meet and what they can convey. It's you can talk about it on a general level, like in society and meeting people, but for our kids and exposing our kids to that, it's just absolutely it's absolutely amazing, and it just is an awesome opportunity to teach your kids. Then, like, also what you talked about, you're helping somebody, but they're also giving something back in return. And you might think, well, it's just a conversation, you're just showing up, you're just doing something. Well, it has an impact on your kids, and it has an impact on the older person as well.
I think it's important to ask yourself too, have you ever had a conversation that comes to your mind periodically that is really valuable to you, and it's something, or maybe just something you overheard, like 25 years ago?
Yeah.
And the answer is always yes.
Right.
Everybody has those. So if you have those kinds of experiences when you're a kid, the volunteering work, talking to these older people and learning from them while you're helping them, as you said, those things stay right here. They don't go away.
Yeah.
So, something will come up, maybe 40 or 50 years from then that, oh yeah, I remember that,
Right.
I know what to do.
They actually did learn something from this, whether they want to admit it or not. That's fine. That's okay. I don't need the recognition. Just if they did learn something, that's a good thing too.
One thing they can learn is, never judge somebody just looking at them.
Oh yeah.
That's probably the biggest thing. Just when you see some person that's all bent over and you think, oh, that's just some old person, they're going to die tomorrow or something, that's the time to talk to those people, because they probably have a lot to tell you. So
70, 80, 90 years of experience and understanding and learning, and so much knowledge. It's it's you can't even fathom the amount of wealth of knowledge and information that if you just took a few minutes to chat with that person about that you could learn from. So yeah, you're absolutely positively right. So Bob, where can people get in touch with you and AgeWise, and most importantly, how can we support you and AgeWise?
Well, as far as getting in touch with us, our website is, the usual www.agewisecolorado.org. And my email address is simply rjbrucker@agewisecolorado.org. Supporting us is really a matter of, we obviously take donations. We're a nonprofit. Every nonprofit takes donations. So there's that. But then bigger than that, though, really is telling other people about what we do and who we are, giving us ideas to contact organizations that might be interested in being listed as a resource on our site. You look at our site, you read the blogs that we already have there, and you say, well, this is all good, but I need to know more about this topic. So let us know. I mean, we're writing this stuff and putting it on there all the time. And because of my conversation with you the other day, Jude, we're starting to talk about, well, maybe we should do podcasts and post them on our,
Great.
And video every once in a while. So we're going to be doing those kinds of things too. And part of our plan all along, besides just the website, was to have educational, events
Hmm.
where we focus in on some particular topic. And a good example is on September 16th, we're co-hosting an event with another organization that is called Caring for the Caregiver. So the whole idea behind that one is caregivers experience extreme burnout because of the work that they're doing, caring for someone else. In some cases, it's like a 24/7
Right.
job. And so how do you help that caregiver take care of themselves?
Hmm.
And so that, they don't go down with the person that they're helping. And so we're going to be talking about that at this particular event. We have a flyer. It's on, it's posted, on our website at the bottom of the homepage. You'll find it, along with this pretty interesting cartoon of the sandwich generation. So it describes it very well.
Okay, I'll have to check that out too. So it's AgeWiseColorado.org.
Yes, that's correct.
Awesome. So, support that. I just say, I again, start thinking about these things, make the plan, and get the kids involved with it. That's not a bad way to do that, right? So that everybody knows and understands what's going on. Aging and people passing away is part of life, and so having everybody involved, not necessarily in that process, but in the process of helping people age and going through that, talking about it, looking to AgeWise Colorado and the other resources out there for information in doing that is just, the best possible thing you can do. So, Bob, thanks for all of this wealth of knowledge. We could probably talk for hours and hours more, and maybe we'll start doing some more around this, because it's really an important topic, and so appreciate the labor of love of what you're doing, because it is truly like you what did you say, you're the all-in volunteer. Yeah, you're doing it all, and that's it's a credit to the person you are. So,
well, I don't mean to imply I'm doing it all, but I'm definitely all in as far as my time and energy. But no one person can do all of what we're doing. But we're helping shape it, guide it, find the resources we need to continue to build the organization out and do all the things that we want to do in the future for the people of Colorado. And that's really what we're all about, and there are no profit motives involved here whatsoever. So it's when we do a good job, it means that people are learning about the issues, and they're finding the resources that they need when they need them. We all know, planning is a wonderful thing, except that hardly anyone does it. So,
right.
So to the extent that you can continue to encourage people to learn in advance of the need, it's going to be so much better.
Yeah, absolutely. Amen to that. And so if you found value in this, please share it with somebody else. That helps us immensely. Leave us a review, subscribe, leave comments as well. All of these things help us to spread this word to other divorced dads about helping in this important topic. So, Bob, it was such a pleasure talking about this. I really appreciate all the pearls and all the vast knowledge that you've shared with the audience.
Well, thanks so much, Jude. I much appreciate the invitation and the opportunity to speak with you today. And best of luck with your endeavors, and best of luck to all the folks who are listening to this. You need it. So,
yeah.
Okay.
More people can help all across the board, the better.
Okay, very good. Thank you.
Take care.
Bye-bye.